have good news if you have a double chin. This is so important.
And if you don't, you will.
You're going to get one.
Yeah,
so
you're going to get one.
Pay attention. All right. So people are always trying to figure out, how do you fix it? There are those exercises. People are always pulling their chin up. Well, an FDA panel, not the FDA, a panel recently recommended this thing that you inject into your double chin. It's a drug called ATX 101, and it's supposed to break down the fat in your double chin.
Yeah.
Dr. Natalie Azar talked about it this morning. Let's watch.
It basically busts open your fat cells. So what the drug actually is, it's an injectable synthetic version of an acid that we already have in our bodies that is actually meant to break down and aid with the absorption of fat in the gut. So you basically take this bile acid, essentially, in an injectable form. They inject it under here. It's called the submental fat. It's a series of injections done 4 weeks apart for about 6 months or so. And what it actually does is it ruptures the fat cell membrane, thereby destroying the fat cell, and the fat cell goes away.
Bring it on. When are they going to improve that sucker?
That is so good. How long before you can get the injections?
They already inject Botox into under there just for the tightening.
But I mean, that's fat, though, isn't Botox?
No, so this is the opposite idea. But a lot of people are already. I don't know anyone personally, but a lot of people are already getting injections there.
All right. So anyway, there are side effects: bruising and swelling. Who cares? Apparently, there are lots of nerves and muscles and things there, and other risks.
So don't hit those. Unfortunately, it doesn't work on larger body parts. That was my first question. That's just zap the tummy, because it would require too many injections. Too many for whom? I think that's a relative question.
I think you're right.
There are many people that would be willing to do, as many as it takes.